This is Breakfast with Stephen and Anne. Somebody is causing a storm today when it comes to the views. Vice in Nottingham says, "Morning, Anne. Just to say, your hair looks nice. Seamus says, has Anne done something to her hair? It looks different and great. Stephen loves the hair. Fiona says, lovely to wake up always, but 30 minutes into the show, something was bothering me and I couldn't think what it was, and I realised Anne has parted her hair on the other side."
Oh, yeah, that's right, I have. You didn't notice.
I didn't notice. So well done you, I'm in trouble.
I don't know why I did it, I just did.
Yeah.
Oh, thank you for noticing. Isn't that lovely? Thank you very much.
Very observant. So there you go, so everyone's noticing apart from me.
Yes, funny that, isn't it?
Sorry.
That's typical, isn't it?
I can't see it on this side.
No, that's no excuse. I've been talking to you outside all morning.
Oops.
Yes.
Okay, let's have a look at the front pages for you this morning. Start with the Sunday Times. No longer feasible to be a full-time GP, says the chairman of the Royal College of Surgeons. The paper reporting nearly a fifth of GPs only work 26 hours a week, as the rest of us struggle to see a family doctor.
The Observer, meanwhile, leads on the travel chaos as one former ambassador to France calls it the new normal after Brexit.
There's anger at Sunak's hardline plans for immigration, according to The Independent. Mr Sunak has vowed to limit refugee numbers and withhold aid if countries refuse to take back failed asylum seekers.
And Liz Truss is also focusing on immigration, as she says she'll send more Channel migrants to Africa. There you are, the front page of the Mail on Sunday there.
According to the Daily Star Sunday, boffins are saying... boffins? Boffins? I don't know. Scientists or whatever. Are saying this will be the hottest summer in Britain for 125,000 years when elephants roamed the country.
And their headline is a yabba dabba few, as in Fred Flintstone.
Clever.
Yeah. They must have fun thinking up their front pages, mustn't they?
It must be sometimes someone's full-time job.
Yes.
Journalist and author Ella Whelan and political commentator Andre Walker are here to take us through the details.
Morning,
Morning
both.
you two.
Morning.
Let's start with this GP crisis on the Sunday Times. It's not feasible to be a GP anymore.
I know it does. It is that the way of framing it does make your blood boil a little bit, because I think most people's experience of trying to get a GP appointment at the moment is it's like trying to get festival tickets. You have to wait on the phone for hours and hours. You have to plead with receptionists, kind of describing your details in gory kind of detail just to get 5 minutes with the doctor. It's a little bit more complicated. So what's actually happening is that back in 2001, as the Times reports, the average workload for a GP was around about 48 hours. It's now the average is around about 38, and that was a survey done last year. So it's come down a bit, but a fifth of GPs are only working 26 hours a week, and they're making up their other time with paperwork, but also doing external things like research projects. And it's sort of an effect of as GPs would put it, the kind of burnout that lots of them just cannot handle the workload that's coming at them from more and more people wanting appointments. Some of the solutions that have been suggested in the Sunday Times is that they cut some of their paperwork. So it does seem ridiculous that you've got a trained clinician filling out appointment forms or something. A lot of it will be, you need some expertise to do some of the paperwork, but it seems like that could be passed on to the front desk. But there's another aspect to it, which is that, before the pandemic, 80% of appointments were face-to-face. And now that's come, it fell down to 50%, now it's around about 60%. But there is still a problem with, I've been fobbed off many times with telephone appointments, and you just know that you need to see someone. I'm pregnant at the moment, and I haven't seen, it's not just GPs, I have not seen the same midwife twice in my entirety of
That
7.5
is not good.
I know, it's really not good. And the same with, there's the Times reports that there are people going private with a specific desire to see the same person twice, paying to simply have a relationship with someone.
But what I don't understand is why they say it's not feasible.
Yeah, that's what I can't understand. If GPs are choosing to have what they're calling portfolio careers, they're doing other things, they're doing consultancies, they're doing university work and things like that. If they're choosing to do that and to keep their hours as a GP down to 26 a week, that's their choice. It's not that it's not feasible.
Yeah. You have to take into consideration also that the average pay for GPs is £100,000 a year. So this isn't kind of, it's not hard, back-breaking labour for 25 grand a year.
Doesn't it highlight the ludicrous situation we're in? When the NHS was set up, they legitimately believed that public health would improve improve over time and the cost of the NHS would fall. You know, we keep moaning on about the involvement of the private sector in the NHS. All of these GP surgeries are private sector healthcare companies, whether they be sole traders or whether they be a group of GPs together. The reality is, we are putting GPs or we're putting trained doctors in the place where they're not needed. They're needed in hospitals. They're not needed to basically dole out penicillin to sick children who are just wandering.
I don't know.
Who does it? They don't.
Well, nurses. Without a doubt, we do not deploy our nurses in a sensible way at all. I genuinely don't believe that we should be training people for 12 years to do what is effectively a relatively easy job as a GP. And I make that point because the minute you come across a challenging case, you're able to refer it to a specialist. The specialists, the people taking on the more challenging cases, should be the doctors. You would cut waiting lists massively if you did that. Now, there would be a cost associated with having more nurses in the community, but I genuinely think it's worth paying.
Oh, I don't know if I can agree with you on that one.
I think a lot of people, the point, you're right to say that a lot of what GPs is signposting, so they just, they see a lump and they send you on to the specialist and that's what you want. But it's also the case that there's, part of the problem with the telephone appointments is that you need to have a certain level of specialism in order to know that the pain in your throat is not just a sore throat, it's cancer or things like that.
Yeah.
And so, it just seems that so much of this problem is as you say, is a staffing crisis. But part of the question is, feasible is an interesting word to use. What is it that young people need to be able to entice them into the role of getting involved in healthcare?
So just if they're doing 26 hours a week rather than 36 or 48, are they still getting the full whack salary?
Well, that isn't outlined at times, I'm not sure. But the idea of research projects and things like that, there are benefits to them because if expanding knowledge and things like that, but there has to be a balance.
I think the other point that I'd make, which I accept that my views are controversial on this, but I've got a friend of mine who's a nurse in a hospital, and she said one of the big problems they have with junior doctors is the BMA have got all these rules on what a doctor can do and what nurses can't do, and it's based on effectively a time when nurses were very lowly skilled and lowly trained. They're now highly trained medical professionals in their own right, and of course what happens is the nurse knows what the patient needs, but legally the junior doctor has to administer it. So what happens is the junior doctor whizzes around the hospital doing 60, 70 hours a week, doesn't really see any patients properly, and it's purely effectively to satisfy a trade union agreement with the BMA, which is totally crazy. We've got these healthcare professionals in the form of nurses, we just don't use them.
It's pharmacists as well. It's interesting because I was in pharmacy yesterday, and a man came in with a child in a pushchair and said, "I can't get to see the doctor. Would you have a look at the rash on my little boy's arm?" And the pharmacist did, and I just thought that's very impressive because pharmacists know what they're doing. They are also highly trained. So maybe we do need a shake-up of our whole primary care system. I mean, if GPs are finding it difficult to do the job for whatever reason, we should be looking at that. Why?
Yes, and also looking at the creaking bureaucracy within the NHS. I went in the other day to get my vaccines that you have to get as a pregnant woman, and in the morning at 11 o'clock I got a vaccine, and then I was supposed to come back at 3 for a blood test. But I sort of said, "Well, you've got a needle in your hand, just stick it in a different part of my arm. Why do I have to come back?" And they said, "No, it's a different form."
It's a different appointment.
And when I came back, I saw the same woman. And so there are certain things which is that we know that the NHS, because it's such a huge beast, it's not very good at organising itself.
It's not efficient, and the trouble is, certainly in my case, there used to be, but at my clinic, there was a diabetic clinic. And you would go in and you get it all done in a day. Your eye checks, kidney checks, blood checks, urine. It would all be done in about 2 hours to get the whole lot done. And now it's all been split off into separate appointments.
But we have a tendency to think of the NHS as one thing. A friend of mine said to me when they were talking about specialist cancer care, when my mother was ill, that the cancer units, these regional cancer units, are absolutely fantastic, literally world class. The NHS is much more like a brand name and a franchise. There are some elements of it which really, really don't work, and there are other elements which are the best in the world. And there just sometimes doesn't seem to be a connection.
But try and shake it up, as you're suggesting, and some radical ideas are not a bad thing, but you tried to shake it up as a politician and everyone's in uproar, you're attacking the nurse.
Third rail, you touch it, you die.
Yeah.
Yes. Yeah, it really
So how do we change it?
Well, I think it's very difficult unless we get out of the idea that there is a binary position. either you keep it as it is or you privatise it, and those are not the two only options.
No, they can't be, can they? There must be something better.
Interesting. Okay, so from NHS chaos to travel chaos, Andre, in the Observer.
Right, well look, let's just be clear for viewers that haven't seen me before. I voted to leave the European Union.
No.
I'm not gonna pretend. Look, the reality is, I do think that this is a muck-up. It's, seeing people waiting for 10, 20, 30 hours in trucks is clearly a disaster. I think the fact that they're describing this as the new normal in terms of having huge queues at ports and indeed at airports, I think it's terrible, but it has to be said, a lot of it is poor organisation on the part of the British government and the Immigration Service. When I worked at the House of Commons, they were able to approve a security pass in 3 or 4 days for people who had 2 British parents and had no criminal record or whatever. Why it's taking months to do it for airport staff? The answer is they can't be bothered doing it quickly because they get into trouble if they do it slowly for the politicians, but nobody's going to take them to task over people working at airports.
Yeah, because they've had months now to sort it out.
Without a doubt.
I mean, you could argue they've had an awful lot.
They've had years.
Yeah, but they've certainly had months.
Well, yeah, and I think sometimes we're supposed to throw our hands up and say, oh, well, this is Brexit. Whereas in reality, you should know what level of throughput you're going to need, and you have the time to build the facilities and whatever.
On the other hand, if the French don't send over their border force people to man the booths at Dover, there's nothing we can do about that. They have to be EU people.
That was, the thing about Dover chaos yesterday was that there was a specific reason, which is that not enough French security staff were sent, and they then said it was because we got held up in the tunnel, and then the tunnel representatives have said, actually, that's not strictly true, you were just late. And so there was a kind of a, whether it was deliberate or accidental, screw up on the other side of the border. But there, I think you're right that I voted to leave the European Union as well, and I hate it when people use the B word to throw at things that simply aren't working. But it's also the case that if you change a system so that you change border systems, you change immigration systems, all the rest of it, and we know that there's chaos in the Home Office and in other departments, you have to be able to make the new system work. And it's very clear that, and also it has to be said that lots of people have forgotten that 2 years ago we had a pandemic where every single thing was shut down in the country. And it seems like from airports and airlines to ferry lines that nobody seems to have realised that people might want to go back on holiday. So you have all these families turning up with kids in the car, and I've done it at Stansted, 3 people on the security desk, and you think, it's July, people are going to be dying.
Well, Adrian's been in touch. Morning to you. He's in San Quentin in France.
Yeah.
He said, I was at Dover yesterday. Out of 14 booths to show documents, there are only 4 open. Also, it didn't help when some travellers didn't have all their documents. We have got our responsibilities.
But that's what I mean about queues at airports and whatever at the moment. The ones that work well are ones that have a man or a woman, obviously an operator, doing the stamping of the passport and everything. But they have other people going through the queue, making sure you've got all your documentation ready, keeping you happy, keeping you filtered and all the rest of it. That's what works. And it's just a matter of workforce then. You just need people.
Well, I'd say,
as you said, it doesn't take long.
Right.
I used to, believe it or not, commute when I worked at the European Parliament. So I'd go every week over to Brussels on the train, which was relatively easy. The train's only 2 hours. But those guys, were pretty well organised. You have everything open. You know when the trains are leaving. You just get on with it. It seems to me it's a manpower thing. And if the manpower thing, which, forget the specific issue yesterday, but the general manpower point, apparently in the UK, is that we can't approve these people for security passes. And it just seems to me to be an easy problem to resolve.
Yeah. You would think so. You would think so.
It is exhausting. Christine has rung in. Hi, Christine. Oh, sorry, I always say rung, it's not.
You do.
Yeah, emailed in and said, if people going on holiday think they have problems, spare a thought for us locals. It takes us about an hour to get to our supermarket, petrol station or something, for a journey that would normally take 5 minutes. We live in Etching Hill in Folkestone, which is about 10 miles away from Dover. All of our country lanes are blocked with people trying to find alternative routes.
Yeah, I can imagine chaos. And that's got to be really frustrating.
Mind you, any customer service department you try to get through to now doesn't seem to work either. I don't know if you've tried to phone up your phone company or...
We are experiencing high volume volume of calls.
Yeah, and basically you get through.
You haven't got anyone there.
You get through to someone, you can hear the baby crying in the background.
Yes,
Well, yeah, they are doing a lot of different problems. I've not had that much bother with all of that. No.
Betty in Dorset says there are 6 weeks of school holidays. Why does everyone appear to make the dash to get away on the first weekend?
Fair point. Fair point. Totally get that. Let's have a look at Hot Britain in the Daily Star Sunday, Ella.
Yes, slap up the factor 50. It says it's a news out from experts at the UN's Intergovernmental Panel on Climate Change, who have made this claim that the climate is at the warmest it's ever been before the Ice Age, which is hence you've got the Flintstones cartoons there. And there has been discussion about the seriousness of the heat wave that we felt last week, and actually, depressingly for viewers and listeners, I don't know if you like the heat, but I don't at this stage.
No, I bet you don't.
Is that it's going to get hot again next week, and with the heat coming up from Spain. And yeah, so they claim that this is the most recent warm period for about 125,000 years. And there have been discussions about whether or not people keep bringing up 1976, and there's lots of people who say, oh, for God's sake, we've been through heat waves like this before, calm down. And there is, outside of the kind of, I think, some of the more alarming figures like this that get thrown around, there is a general trend that most people can see, which is that there has been some impact on the planet in terms of warming from human activity, obviously, because there's more of us and there's more of us doing things, and that creates changes to the climate. But the question is, if this is going to be part of our future, hotter summers, colder winters, whatever it is, can we please talk about some of the infrastructure? So rather than just panicking about it, can we talk about changing railways? Can we talk about maybe changing the way in which we work? If it's the case that you're going to have to turn into the Spanish where you have a siesta in the middle of the day.
Oh, yes.
There's none of that.
Well, I do
None of that
anyway,
long-term planning.
Yeah, well, this is it. We've got to, instead of moaning about it, we've just got to get on
Adapt.
around it.
Got to adapt.
Right, but when you say adapt, I see time and time again an effort to not adapt. I mean, near me, they've been dredging the Thames for 200-300 years, literally, to avoid flooding. The Environment Agency banned it about 10 years ago, and consequently, there are now floods. And the response from the Environment Agency is, this is a result of global warming. Well, of course, the local farmers turn around and say, we think it's a result of you banning the dredging. And you read these reports from public organisations, and their solution is to reduce carbon emissions, not to take any action whatsoever on the impact of it. So Ella, I think you're not going to get your desired wish there.
Well, it's joined up thinking, though, isn't it?
Yeah.
Which just doesn't happen.
No.
And this is the problem.
It's a depressing day today, isn't it?
It is depressing. I'm just thinking, if I give you this, Andre, is it half empty or half full? With you?
Is that vodka? No, I'm joking.
No, it's cold tea. It's cold tea.
I'll get into trouble for that later, won't I?
Okay, so we've got now 2 migration stories. Andre, let's start with you looking at Rishi Sunak's take on
Yeah,
migration.
so on behalf of both Ella and I will say that everybody's trying to outdo themselves on the immigration thing to get to the right, and obviously Liz Truss is ahead. It's worth pointing out, by the way, that the Conservative Party always sends its ballot papers straight away, and if you're ahead early on, then you'll probably end up winning. I just make that point in general. But Rishi, it's in various papers, but Rishi apparently has a 10-point plan to slash migration. But one of them, which I think is really odd, is this idea of limiting the number of refugees. Because, I mean, my understanding is that you have an absolute duty to take in genuine refugees. You can't limit the number. The issue is working out who's a genuine refugee.
Yeah.
And so I don't fully understand where he's going with this.
It almost seems to be an empty headline, that, doesn't it?
I think it does. I think it's not practical to turn around. I mean, it's clearly okay to turn around and say we're not happy about people going to the first country and not staying there. It's clearly, you can say we're not very happy with people taking dinghies for safety and for legal reasons. But to say, I don't know, there's a repeat of what happened in the 1940s, and we've decided we're just going to not bother taking people in, it seems to me to be relatively unrealistic. But and also I don't think it addresses the problem. I think bogus refugees are the problem, and I say that I've done a lot of humanitarian work in Ukraine, and in my experience, the vast majority of refugees are going to countries like Moldova and Poland simply because
They want to get back.
they want to get back as soon as possible.
Yeah.
What's Liz Truss saying about it then?
Well, as Andrew says, there is a bit of a race to the right or race to the bottom in terms of empty slogans. So Liz Truss's plan now, that's reported in the Mail, is, well, I'm going to send more of them to Africa. So she's basically saying, like the Rwanda policy, I'm going to duplicate that with different nations. I'm going to, make it work. I mean, you can't just say I'm going to make it work.
It's not exactly working now, is it?
Exactly. When the current policy is tied up in, in the courts, that there's absolutely, as the Mail points out, we've paid £120 million up front and have sent, something like 200 migrants have successfully been sent there. There is to be fair to Liz Truss, she also talks about the fact that she wants to increase staff at Border Force, which, as we were just talking about, is probably no bad thing in terms of having more men and women.
But again, that's a very easy thing to say now, and we're calling for it, isn't it? And she's saying it will get done. Can we trust any of these people to actually do anything when they're in power?
The key thing about the problem with immigration, and if this goes for both sides of the argument, someone like me who wants a more liberal approach to immigration and someone who wants a more strict approach, everybody agrees that there should be a controlled approach, that you know who's coming in, that you have secure borders, that you have a system that works. Is that the whole way in which both the asylum system and the immigration system works is fundamentally incompetent. I mean, you have literally folders being lost. There was a report out earlier this week about the fact that lots of the people who are being processed cannot be identified afterwards. There's simple things like their surnames are missing on forms. So there has to be an overhaul from the top to the bottom of the way in which the immigration system works. Looking at the fundamentals of the Home Office, we know that, for example, throughout the pandemic, lots of people worked from home and basically weren't answering emails. That's what happened in relation to the withdrawal from Afghanistan. The system is completely fundamentally incompetent.
But I do think that Priti Patel, God bless her, had a good idea when it came to the number of legal challenges. You get to a situation with a lot of these people when you're attempting to throw them out of the country for not being legitimate refugees, where you get whacked with 10, 15, 20 legal challenges in order to just delay the process. That's why nobody's gone to Rwanda. And her idea was that it gets to a point where the law firms themselves have to start paying for the challenges, rather than it coming out of legal aid, because you see these planes being sent and there will be, say, 100 people allocated, of which 98% have had their 15th legal challenge filed and can't be on the plane as a result. And what's happening is, and I don't want to slag off lawyers all the time, that effectively there are a group of people who are principally left-wing, pro-immigration lawyers who are trying to come up with their own immigration policy through vexatious litigation.
Well, legal aid is our money anyway, isn't it? And if it goes on being spent again and again and again, as you say, then it's not a system that clearly isn't working.
No, I suppose they can't just put them on a plane anyway. I mean, what's stopping them, really?
Well, funnily enough, this came up with Theresa May about Abu Qatada. You remember that chap?
Oh, yes.
But so somebody asked her in ministerial questions the question that I would have asked, how illegal is it for you to just grab him and stick him on a plane? Is it 10 years in prison or a 50 quid fine? And she said it's not appropriate for the Home Secretary to break the law, even if it is only a misdemeanour. I suppose that's right.
Well, yeah.
That is right.
Yeah.
There is a question of, as on an individual basis, if you are at threat of being deported, I don't think it's necessarily kind of conspiratorial left wing to say people should have access to appeal, because from an individual perspective, and we know that with the Windrush scandal, that without the kind of access to appeal, lots of people would have been deported who were absolutely not relevant to and were not illegal, and that's why the Home Office is this creaky institution that can't actually get things right. But on the other hand, there is a kind of democracy question, which is that because of rules relating to, as we say, things we've signed up about how many refugees we are supposed to take in, because of the way in which the legal system works, you have courts thwarting the political will of an elected parliament, because let's remember that the Conservative government, even if I don't agree with their Rwanda policy, were elected to do something about borders. And if you have courts and judges coming in and thwarting that, it doesn't look good for the judicial system, because people start to talk about conspiratorial judges.
It just doesn't achieve anything at all, does it?
No.
It's just a waste of time.
Well, look, on that note, we're out of time. Ella, Andre, thank you very much indeed for that mammoth look through the papers this morning. Very good. We've got much more to come for you in a couple of minutes, including the very latest on that ongoing travel chaos.